Hello, I'm Brody Wood. I've been with Olympia Orthopaedics the past 3 decades, and I'm here to talk with you about wound healing after total joint arthroplasty. First, swelling is a normal part of the postoperative process, but must be monitored very closely. Excessive swelling can compromise blood flow, delay healing, and can increase the risk of dehiscence or the wound coming apart. Elevation, compression, and early gentle mobilization are critical in managing this. Next, diabetes is a major factor. Elevated blood glucose impairs white cell function and collagen production, slowing down wound healing and increasing infection risk. Tight sugar control before and after surgery is essential for optimal outcomes. Smoking is another significant concern. Nicotine causes vasoconstriction, or tightening of the blood vessels, and reduces oxygen delivery to the healing tissues. Smokers are at much higher risk for wound complications, including necrosis or death of tissue and infection. Patients should be counseled to quit well before surgery and to remain abstinent from any tobacco products during the postoperative recovery process. Nutrition is often underestimated but plays a very crucial role. Adequate protein supports tissue repair, and deficiencies in vitamin A, vitamin C, zinc, and iron can all impair healing. A malnourished patient is a high-risk patient regardless of body size. Wound climate refers to the local environment at a wound site. A moist wound environment, not fully wet and not dry, promotes epithelialization or production of skin and healing. Appropriate dressings that maintain moisture and protect against contamination are key. You will be sent home with an antibiotic, silver-impregnated dressing that maintains this environment. Bleeding and drainage are red flags postoperatively. While some serosanguinous drainage can be expected early on, that would be a yellow or clear drainage from the wound, persistent bleeding or increased drainage may indicate a hematoma, seroma, or infection. These require prompt evaluation. Redness around the wound should be monitored closely. Some erythema is expected in the early days, but spreading redness, warmth, and pain could signal cellulitis or a deep infection. Early identification and treatment are critical to prevent deeper joint involvement. Optimal wound healing after joint replacement hinges on controlling modifiable risks like glucose levels, smoking, and nutrition, while closely monitoring the wound for signs of complication. A proactive approach can make the difference between a smooth recovery and serious setbacks.